July month is Sarcoma Awareness Month. Sarcoma means a cancer arising from the connective tissue. That means the tissue which supports our body. For example, bone, muscle, cartilage, blood vessels, tendons, nerve sheaths. So all these things are called as connective tissues. Whenever the tumor arises from this, is called a sarcoma, a malignant tumor. Always there is a possibility for benign tumor also to arise from these connective tissue, which is apparently more common. But if there is a malignant tumor arising from this connective tissue, it is called sarcoma. So generally, these sarcomas are divided into bone tumors and soft tissue tumors. The bone sarcomas are osteosarcoma, Ewing sarcoma. These are all bone sarcomas. Whereas you have sarcomas arising from the soft tissues, like from the blood vessel, nerve sheaths, tendons, muscle. So they are all called the soft tissue sarcomas. Even the fat tissue, that is called liposarcoma, arising from the fat which is in the body. Rhabdomyosarcoma is a sarcoma arising from the muscle. So this is the terminology that we have to be acquainted with. And the most important thing is, most of these sarcomas, they affect young children and middle-aged people. It's not so common among the older people. And unfortunately, there is no cause by which these sarcomas are related to. So most of these sarcomas are due to genetic aberrations caused by various disorders. So there is some evidence that it is closely related to herbicides, pesticides, and some chemicals, like industry. People who are working in the vinyl chloride industry, there is a higher chance of getting the angiosarcoma of the liver. So like this, there is some kind of an evidence. So how do you diagnose these people? So most of the sarcomas, they affect individuals' upper limbs and lower limbs. So that means the arms, hands, and thighs and legs are affected. So whenever you find there is an abnormal swelling arising at a joint level, or just above the joint level, or in the mid of the arm, or a forearm, or a thigh, or in the leg, you should always have a suspicion. So when do you suspect that this tumor is malignant? Whenever the tumor is increasing in size very rapidly, that means over the period of 1 or 2 couple of weeks, if it is increasing in size, then you have to suspect. Or if there is any severe pain, or if the skin over the swelling is stretched and you can see the blood vessels, then that means it is likely to be a malignant tumor. So what you have to do? You have to immediately consult an oncologist or an orthopedician for investigations. So basically they do what is called a biopsy. The biopsy is like they take a small piece of tissue from the swelling and then they examine and see whether it's a benign tumor or a malignant tumor. If it is a benign tumor, just a surgical excision is sufficient enough. If it is a malignant tumor, then you have to see exactly what is the stage. So the patient should have a PET scan or a CT scan of the chest to rule out if there are any distant metastases in these patients. Once the PET scan or a CT scan of the thorax has been done, then you can say that the patient is fit for a surgery. So surgery is the mainstay of treatment. Surgery should be done immediately as soon as you diagnose the patient if it is operable. Then after surgery, the specimen will be studied for what is the grade and what kind of molecular markers that the patient is having should be studied. On the basis of that, there is a plan for adjuvant treatment. So you have to assess the risk of recurrence in these patients, how common or how often you get these patients coming back with the disease. So basing on that, these patients will be given chemotherapy and radiotherapy. So this is how you have to understand about the sarcomas. Thank you very much.